Imagine waking up one day and realizing that something doesn't feel quite right. Maybe it's a slight tremor in your hand, a stiffness that wasn't there before, or a feeling that your movements are slower than they used to be. These might seem like small, unnoticeable changes, but they could be signs of something more significant, something that affects millions of people around the world. Today, we're diving into the world of Parkinson's disease, what it is, what causes it, and how we can live with it. Welcome back to the channel, where we break down complex health topics in a way that's easy to understand. So, if you or someone you know has been affected by Parkinson's disease, or if you just want to learn more, stick around. We've got you covered. What is Parkinson's disease? Parkinson's disease is a progressive neurodegenerative disorder. It starts in the brain and, over time, affects your movement. The issue lies in a part of your brain called the basal ganglia, which controls motor function. As Parkinson's progresses, nerve cells in this area start to die. One of the key players in Parkinson's disease is dopamine, a chemical messenger in the brain that helps control movement. As dopamine levels drop, the brain's ability to send clear signals to the muscles becomes impaired, leading to the hallmark symptoms of Parkinson's. Symptoms of Parkinson's disease. So, what are the symptoms of Parkinson's disease? Well, they can vary, but most commonly people experience tremors, slow movements, and stiffness. Let's start with tremors. It's one of the most recognizable symptoms. These rhythmic shakes often begin in the hands, but can also affect the jaw or even the foot. Sometimes, the tremor happens when your muscles are at rest. This is different from the shaking that happens during movement. Next up, bradykinesia or slowed movement. Simple tasks like getting dressed or brushing your teeth might take longer because your muscles aren't moving as quickly as they once did. Stiffness or rigidity is another common symptom. This can cause discomfort in the muscles and joints and can make movements feel jerky or uneven. One symptom that's often overlooked is a change in facial expressions. People with Parkinson's disease can develop something called hypomimia, which means their face becomes less expressive. It can make someone look like they're mask-like, even when they're not feeling that way inside. And speech can also change. It may become softer or more monotone. In more advanced stages, people may have trouble speaking clearly. What causes Parkinson's disease? The cause of Parkinson's disease is still not fully understood, but we do know that it involves the death of nerve cells in the brain. This brain damage leads to a decrease in dopamine levels. But it's not just a lack of dopamine. Abnormal clumps of protein called Lewy bodies are also found in the brain, and these clumps contribute to the progression of the disease. Genetics may play a role in some cases. If you have a family member with Parkinson's, your chances of developing the disease increase slightly. But the majority of cases are considered idiopathic, meaning the cause is unknown. Risk factors for Parkinson's disease. Parkinson's disease usually affects people over the age of 60, though it can happen earlier. The average age of onset is around 70, but there are rare cases where people develop Parkinson's in their 40s or 50s. Exposure to certain environmental factors, like pesticides or well water, can slightly increase your risk. However, no single environmental factor has been proven to cause Parkinson's. Interestingly, men are more likely than women to develop Parkinson's disease. If you have a family history, your risk may be higher, but it's not a guarantee. How is Parkinson's disease diagnosed? Diagnosing Parkinson's disease typically involves your doctor looking at your symptoms, medical history, and conducting a physical exam. Imaging tests, such as MRI or PET scans, might be used to rule out other conditions. In some cases, Doctors might perform a spinal tap to test for abnormal proteins in your cerebrospinal fluid, or a skin biopsy to check for nerve tissue changes that could indicate Parkinson's. Treatments and management. While there's no cure for Parkinson's disease, there are treatments to help manage the symptoms and improve your quality of life. The most common treatment is medication. Levodopa is often prescribed to increase dopamine levels in the brain, which helps improve movement. Over time, however, you might need a combination of medications, as the body can become less responsive to levodopa. For people in the later stages of Parkinson's, deep brain stimulation can be an option. This involves implanting a small device that sends electrical impulses to the brain, helping reduce tremors and stiffness. Living with Parkinson's disease. Living with Parkinson's can be challenging, but with the right treatment plan, you can still enjoy a high quality of life. Regular exercise, mental health support, and staying connected with your healthcare provider are essential. Exercise, especially aerobic activities, has been shown to slow the progression of symptoms. Keeping active helps with mobility, balance, and even mood. Conclusion: Parkinson's disease is a complex condition, but it doesn't have to define your life. With early diagnosis, proper treatment, and a supportive lifestyle, you can manage the symptoms and live well. Remember, you're not alone. There's a whole community of people and healthcare professionals ready to support you. Thanks for tuning in today. If you found this video helpful, give us a thumbs up and don't forget to subscribe for more health tips. Have questions? Drop them in the comments below. We'd love to hear from you. Take care, and we'll see you next time.